What's good, everyone? This your main correspondent, Alan Taylor, and I'm back in the broadcast room. And this is where we at now. So apparently we have a situation here where a mother was pretty much turned down by the hospital care, stuff like that, while she was basically in labor. And she was turned away, things like that. She ended up having the child in the car, and her and her husband, things like that. So yeah, we're going to talk about this situation here because this is crazy, because apparently definitely Black women are having a hard time with the hospitals in labor and stuff like that. And this is not the first time I've heard this. This is, what I'm saying, this has been an ongoing situation for quite some time now in this country and things like that. But now shit is hitting the fan. We got more technology to see things. So I want to go here now. I want to check something out. What's the information on Black women and giving birth in hospitals?
Black women face poor outcomes during hospital births, including higher rates of C-sections and maternal deaths. Factors like systemic racism and mistrust contribute to these disparities, along with reports of mistreatment and longer hospital stays. Advocacy groups are pushing for policy changes and increased access to community-based care.
Okay, so this is where we at here now. Let me go back a second here and see what's going on. Yeah, and that's where we're at. So we're going to go here now and we're going to check things out and see what this news report has to say about this horrible situation where this mother and father have to go through this terrible ordeal. Quarters, nickels, and dimes.
A mother and father are demanding policy changes at a Northwest Indiana hospital. They claim they were turned away from that hospital and forced to deliver their own baby on the side of the road. Arnold Brennan covering this story for us, and you spoke to the couple this morning. What did they tell you?
Well, so they've hired an attorney, and that's where they spoke to us from, the attorney's office this morning. They told us they spent 6 hours at Franciscan Health in Crown Point, and instead of being treated and greeted with empathy, they say they were ultimately sent out the door with a security escort.
A baby delivered in a car suggests a mother didn't make it to the hospital in time.
Being put out in active labor.
But Mercedes Wells made it to Franciscan Health in Crown Point, Indiana.
My daughter is being kicked out of this hospital.
She and her husband, Leon, say the hospital turned her away while she was in labor, forcing Leon to deliver their daughter in the front seat.
We walked out of the hospital at 6:20 in the morning, Sunday morning, and the baby came 8 minutes later.
Baby came out, and just didn't know what to do. I just prayed and asked God for guidance.
Now the couple has a new baby girl and a new attorney.
This is something that should have never, ever happened.
The Wells family says they called ahead to the ER, knowing baby Alina was coming 2 weeks early.
I was met with really stern faces, like no welcoming faces, as I usually would get when I go to a hospital or a place of care.
Mercedes says a nurse who checked on her said she wasn't far enough along and seemed intent on sending her away.
I was in excruciating pain. She seen me in pain and agony, and I guess she still perceived me to not be in labor.
Her contractions were just a minute apart, but the mother of 4 says she was discharged on doctor's orders without ever seeing a doctor.
Accountability looks like making certain that the woman that made the decision to kick her out of this hospital doesn't work there anymore.
The couple claims it was discrimination.
I've seen how common it is in the Black community, so I know that it happens often. I just never thought it would happen to me.
They want a sit-down meeting with hospital administrators to talk policy changes so no other mother in labor is turned away.
So in a statement, the president and CEO of Franciscan Health Crown Point says the videos that the Wells shared were, quote, deeply troubling, adding that they don't represent the healthcare system's values. And Marie, they've also launched their own investigation into what happened.
Curious.
Lord have mercy, their own investigation. Why do all these super entities and stuff, corporations and hospitals, what's up with this internal investigation crap? What do you need to internally investigate? Clearly, this lady, the nurse, whoever, she didn't actually do her job properly to figure out whether this woman was really in labor. Because if she would have done her job properly, she would have found out that the woman was in labor. How you send the woman out, then 8 minutes later, almost something to a degree, give or take, she has the baby on the side of the road. What are we doing here? And this is troubling. This is highly upsetting. You know what I'm saying? I hate that our sisters are out here going through this tragic mess. This is ridiculous. And at the same time, though, too, these people will send a high-ass insurance bill to your house. You had a baby at a hospital, they want to send you a $1 million bill as an average person because you had a baby there. Man, get the This is ridiculous. We're going to keep going because there's always more on the bottom line. And this is tragic right here. This is totally tragic.
Now, only on CBS News Chicago, some new perspective on the mother who gave birth in a pickup minutes after being turned away from an Indiana hospital. As Suzanne Lemonnier reports, the 911 call between family and dispatchers reveals just how chaotic those moments were.
I had to keep myself from crying because I didn't want nothing to happen to my wife or my baby. That was my biggest concern. Well, I see my child's head when I called 911. And so, like, at that point, it was action time. I didn't know exactly what to do, but I knew to do something.
Leon Wells reacts after hearing his voice for the first time in this 911 call he made while driving along I-65.
What is the location of your emergency?
My wife's having a baby, and I'm in the car driving to the hospital.
I'm sorry?
My wife,
What mile marker are you by?
I'm on 30. I'm past the 30.
I'm sorry?
I'm past the 30 right now.
Daughter's being kicked out of this hospital.
Wells made that call after his wife Mercedes Wells was wheeled out of Franciscan Health in Crown Point, Indiana, while in active labor, after the hospital refused to admit her. The moment captured in this now viral video. Baby Alina was born 8 minutes after they left the hospital.
My wife's having a baby right now in the car.
What were you thinking as you had to repeat that over and over and over?
I was frustrated through the whole thing, as far as us having to repeat ourselves as I'm telling her and asking for help.
In response to the call taker repeatedly asking Mr. Wells where he was, the executive director of Lake County 911 told us the dispatcher was being given a route number and not a mile marker as requested. The call was then transferred to Indiana State Police. A minute and a half after Wells first saying the baby had been born, that call taker asked,
How far apart are her contractions?
She had the baby. She had the baby in the car.
It was pointless to call. That's how I kind of see it. However, I'm glad that we were able to get it to where, get it on tape so the world can really hear what we were experiencing at the time.
Yes. And this is going to be a game changer out here. Definitely for our Black sisters that are having to go through this terrible situation. This is crazy right here. How you as a hospital, anybody that comes into a hospital, rich or fucking poor, you're supposed to make sure that you check these people out thoroughly before you send them back on their way. Hold on here. This is ridiculous, bro. And then they have the audacity to want to send these people insurance or bills and stuff like that, and they be astronomical bills. You have to call the ambulance. It's damn near $5,000 just to call a fucking ambulance. This is crazy out here. And then you want people to respect these professions when they're doing crap like this over here, turning their backs on this lady when she in mid-labor. 8 minutes after they kick her ass out the hospital, now she's having the baby in the car. Yeah, I'm pissed about this. I can't stand seeing sisters out here have to go through these types of things. This is healthcare situation here. This is very vital. We in this country, we pay taxes tremendously out the ass, and we need our hospitals and all these types of people to do what the fuck they're supposed to do. Write that shit off at the end of the year if you have to. Shit, y'all giving all this money to these fucking illegals. You giving illegals free healthcare out in goddamn California. But this lady right here in Indiana had to fucking suffer and have a damn baby in the car. This black lady right here. Excuse me. This is Sorry. This is ridiculous.
Wells hung up with that dispatcher and called 911 again and had a totally different experience. And a team was waiting for the family at Community Hospital in Munster when they pulled up. Suzanne Lemignot, CBS News, Chicago.
So Jesus, man, this is wild, bro. This is wild. So let's go here now. Apparently, they're putting legislation in about this particular situation. And this woman, thank God for this black lady right here and her husband. Shout out to him. You know what I'm saying? It's good to see a good married couple. And he's speaking up. They're not trying to, dismiss his voice. I'm glad to see this. This is great for the outlook of the black community. I love to see this shit. So apparently they're putting in legislation behind what they, seen in this footage right here that's gone viral. Let's go here now.
Our healthcare system is broken. Black women across the country are suffering and dying.
An intimate moment of pain captured for the world to see is now sparking legislative change.
Mercedes' courage propelled me to introduce new legislation to protect all moms.
Earlier this month, a black woman, Mercedes Wells, labored for 6 hours at Franciscan Health Crown Point Hospital in Indiana before she was discharged without ever seeing a doctor. Minutes later, she gave birth in her car. The video prompted backlash, and one day after our NBC News report,
Clay, what'd you learn?
Yeah, Tom, change. The hospital's president and CEO apologizing to Wells and her family, firing involved hospital staff, and mandating cultural competency training for all labor and delivery staff. And now there's new legislation, the Wells Act, announced by Illinois Representative Democrat Robin Kelly.
This is a pretty swift response to an incident that happened just over a week ago. Why now? Why is this so important? And what's in it?
I've been working on the issue of maternal mortality and morbidity for about 9 years. So this is just another chapter. It needs to be done.
Yeah.
Nothing.
So basically, the what's happening here is if this lady right here has been putting in the work for, she said, 9 years. This is a long time. And it's sad that this situation had to go viral for everybody over here to see that, definitely black women are being treated like this in our hospitals while in labor, trying to give life. And I get it. We're on this new age trope out here in America. Oh, let's delete the babies. Previous administration, they love to do that. Jesus Christ. Man, I'm pissed off, because I get it. And it's sad that our black sisters that our African American sisters are going through so much of this craziness here, and fuck it, it's not even African, that our, black American sisters are going through this because she's an American first. Screw the dumb shit. Let's keep going, people.
To play around with.
The Women Expansion for Learning and Labor Safety Act seeks to require any hospital that provides obstetric, emergency, or labor and delivery services to have a safe discharge labor plan before discharging a patient who presents with signs or symptoms of labor. It also mandates racial bias training for healthcare professionals.
Why do you think this will have bipartisan support? Is this an issue that resonates?
Too many women, period, die in the United States. We don't rank well with countries like us. So women are interested. I mean, all kind of women die, but black women die more.
The lawmaker's office drafting the legislation after.
I didn't know in the 21st century that women were still dying from labor like this. In the 21st, with all this medication, health care, doctors are supposed to be the most prestigious doctors in the history of the world nowadays with all the technology, and women are still dying in labor. Oh my goodness, man, this is sad. This is sad.
We're seeing video of Mercedes Wells, an Illinois resident and constituent of Representative Kelly, the two appearing in a press conference on Tuesday. The lawmaker has led maternal health legislation through Congress before, including the Maternal Health Quality Improvement Act, which passed in 2022, and she reintroduced the Care for Moms Act this week, which is not yet passed.
Still, The numbers are very, very bad for Black women in the United States, still 3 times more likely to die from pregnancy-related causes than their white counterparts. So it seems that the legislation is not doing enough. What's missing? What's the missing link here?
Well, I mean, racism is a big link of it, systemic racism, and that's what we have to work on.
Why has this been so important for you to champion as a mother, as a lawmaker?
I had no idea that this was happening until someone called me up and said, I want to tell you a story. I did not realize it was such an issue. And I hit the ground running and just learned how many people have been impacted by this.
That's good, though. That's definitely good. Thank God that, you know, somebody's on the case, on the job, you know, and in this particular situation, I think it is going to take she looked like a sister, but another woman, period, to, you know, put more light on this situation. You know what I'm saying? It's not just that it's just a woman's issue. It's a human issue, you know, because we are all born from women. And the thing of this is that we want our women, period, whatever shade, whatever culture, creed, anything, we want our women to be able to give birth safely in the 21st fucking century, when we're supposed to have all this technology that's supposed to actually acclimate and make sure that we are allowing these women to have children safe. This makes no sense right here, that these people turned this lady and her husband around and they had to have their child in the car on the fly. This makes no sense here, man. This is a sad day that we're living in here in America. And it's oh my goodness, man. Ooh-wee. Man, this is dangerous, but it is what it is, though. Shout out to all my subscribers. Mad love to y'all. If you're new to the channel, please hit that like, share, subscribe button. Make sure you ring that bell to be notified whenever I decide to post things. And like I always say,
and that, my friends, is the bottom line.
That, my friends, is the bottom line.